Hip and knee replacement. Dr. Rory Sandberg is here. Thank you for being with us once again. Learning a lot here in this half hour so far. We have another half hour to go, so that means plenty of time to call in with your questions. The number is on the screen, 615-737-PLUS. Let's jump to Ann. She's on the line. Ann, thank you for calling in.
Yes, this is Ann.
Yes, hi Ann. Go ahead with your question.
Okay, I want to know if he's ever put a half of a knee replacement in.
Yeah, so good question. Called a partial knee replacement.
Okay.
Yes.
I do perform partial knee replacement surgery, and it's actually a really good surgery in the appropriate candidate.
Okay, who would that be?
So the appropriate candidate for a partial knee replacement is somebody that on x-ray has the majority of their arthritis in one location. We talked earlier about how the knee has 3 different compartments. So if the majority of their arthritis is located to that one compartment, and that's where the patient is symptomatic, meaning that they have arthritis in one location, but they don't say their whole knee hurts. They say it hurts right in this location where the arthritis is. That's a really good candidate for a partial knee replacement. And the outcomes are really quite good. They show that partial knee replacements versus total knee replacements in the right candidate, the partial knee replacements can have a quicker recovery and they have a higher patient satisfaction than the total knee replacement. But I can't stress enough that the right candidate is important. And in the orthopedic community, we're still trying to delineate who that right candidate is. There are some surgeons that accept a little more arthritis in the other compartments than others. Where I trained, we were pretty stringent on arthritis in one location and having the symptoms in that location. And when we did that, we had very good results with our partial knee replacements.
So you're saying you try to keep it pretty black and white, but in other places it gets a little gray.
I do. Where it gets a little gray is sometimes under the patella, so under the kneecap. There's variable amounts of data showing, you know, how much arthritis can you accept under that kneecap and still get away with a partial knee replacement. This is an evolving area, and I don't know that there's a good answer for that yet, because certainly I've seen patients that have a partial knee replacement with a decent amount of arthritis under that kneecap, and they love it. They're functioning great. So it's still kind of an emerging area in terms of who the exact best candidate is.
Okay, Ann, thank you for your call. We appreciate that. Great call tonight. I do want to talk about the folks who have decided, yes, I need a joint replacement, whether it be the hip or the knee. And these answers may vary a lot depending on what joint it is. But what do the surgeries look like, as in the amount of time spent on the operating table? And then let's talk about recovery a little bit. Okay.
So time spent on the operating table can be a little variable. I tell patients it's anywhere from an hour to an hour and a half as just kind of a ballpark for a hip or a knee. The surgeries themselves, I mean, you can look at them on the internet and on YouTube. They're not for the faint of heart to look at. They're pretty open surgeries because we have to see things clearly enough to get the implants in. That being said, we do much smaller incisions and exposures than they did when the surgeries were first brought into the field, but it's not the same thing as having an arthroscopy. They're usually in the hospital overnight over at the Summit Hospital where I practice, and most patients are able to go home that next day after surgery. Sometimes they need to stay a second night, but we really try to make a conscious effort to get patients home and get them home safely within a day or two. The day of surgery, we have physical therapy that sees people twice a day, so you actually get up and walk the day of your surgery for a hip or a knee. We found that these rapid recovery protocols really do a lot to help people have the best outcome with their knee or hip replacement. And after that, it's just kind of a recovery process. For the hips, I don't send my hips to physical therapy. It's really just a matter of getting up and walking. For the knees, we do some type of physical therapy for 2 to 4 weeks.
Is it basically to get the motion back? What is the physical therapy or the exercises all about? Go ahead, if you need your water, go ahead and grab it. No problem. It looks like we have some callers coming up on the line. So if you guys want to tell me the callers' names, I will get those written down and we'll take that. But until you guys, our producers, when I say you guys, I'm talking to our producers. Until I hear those names, that's okay. It happens to the best of us. We'll talk about just when it comes to the hip or the knee. You mentioned that the hips usually can go home, which is great, but are there restrictions at home and things that people need to be advised about, like getting in and out of the shower, that sort of thing?
They do, and hips especially.
You know
there
what?
are some restrictions.
You know what? Let's take a quick commercial break. We'll give you time to recover, because I've been in this situation before, and it's miserable when you just need a good cough. So we're going to take a quick commercial break. When we come back, more of your questions, more of my questions. We're coming back on Medical Monday.